timeline of these meetings, how often we're gonna meet, but again, really appreciate you taking your time, to help us kind of shape this and see how this comes together. Again, we have the mayor and some of the councilors who are listening in, and they'll be, we'll be reporting out to them as we go through this over the next 6 months here, so really, it's a fantastic opportunity for you guys to provide your insight and skill sets to us, and working with the staff as we report with that there. So what I'd like to do first today is just really kind of hold us to time. We're gonna try and wrap up by 5 o'clock here today, so today's more of just a kickoff meeting, right? So just really understanding who's on this task force, talk a little bit about your experience, if you live here locally, or maybe you're somewhere within the county, and a couple minutes just about a little bit about yourself and your organization. It's helpful, right? And then from there, we're going to take a deeper dive into just talking about meeting minutes and rules of discussion and how we want to handle that within the group here today. And then Heidi is here just from a staffing standpoint to talk about staff support of House bill and how the funding has come to Sheridan, what that bill can help to do for the community. And then we're going to go into just kind of talking about, the city council has some ideas of what they're thinking, for this, but they want to hear from you as members of the community. We've cast this wide net. We've got a good representation of folks in here. What kind of resources we have, what kind of resources are available. And then we're going to talk a little bit further as we go through the meeting, just about understanding the point in time count, right? That's going to be conducted in January, right? So working through that with the county over the next couple months, we're just going to be really gathering data information. Data is important for us. Data helps us shape what programs we need. At the same time, I'm going to ask you as a homework assignment to kind of come back and talk about what kind of resources we have within the community or within the area, and what that looks like for us as we go forward, understanding what is our data point and what is really truly in Sheridan or in the outlying areas that we understand from that standpoint there. And then we'll close with talking about the meeting schedule. I'm proposing that we'll be meeting once a month, and this time probably the second Wednesday. So think about that as we go through talking today. But that's kind of the time I'm thinking. And each time you'll have some assignments that you'll work on. You come back, report to the group, and we'll report out to the council a couple of times as we go through this process there. So if we can just kind of do a round robin, and everyone just introduce themselves, a little bit about your organization. If you live here in Sheridan, or if you're outside, or that's helpful too. So, thank you.
I'm Julie Ray. I work with the Working Hope in McMinnville, and we provide services for drug addicts and alcoholics and people wanting to get clean. Homeless people, we've got a lobby where they can come in as a safe place where there's not going to be any drugs or anything. They can get a hot lunch. They can meet with peers that will help network them into other services. We work with drug court and Yamhill County, Penn DHS, and I've lived here for 23 years in Sheridan.
Thank you.
My name is Amy Stuck. I'm a participating community member, and I live here, and I care about this community, and that's why I'm here.
Glad to have you. Thank you.
My name is Stacy Coker. I am a co-owner of the West Valley Bulletin Board, which is Sheridan, Willamina, Grand Run, local community newsletter / newspaper-ish. I also am a member of numerous boards, including the Sheridan Tree of Giving, Sheridan Chamber, and a member on different organizations. I was born in Willamina and brought home this property my husband and I are still on. And so not only owning a business in town, but pretty much a lifelong community member. I have a lot invested in this wonderful place.
What is the business you have?
The West Valley Bulletin Board.
Oh,
So it's like our local.
Okay, I stopped in your
Yes,
shop.
yeah, absolutely. Mm-hmm.
Nice for being here.
I'm Amber Hanson, I'm the Deputy Director for YCAP, the Yamhill Community Action Partnership, and that's our flyer. So I'm really excited to see that on the table and happy to part of what really drew me to this. A couple reasons professionally, I wanted to be able to contribute what knowledge YCAP has related to homeless services and housing assistance and prevention, and also just really impressed and drawn to the fact that this relatively small community has got this large group of people together to take a very proactive approach to this issue, and that's exciting, and I want to be part of that and contribute to it.
Hi, I'm Jessica Helms. I'm actually newer to the community. We've lived here for about a year and a half, but I'm a mental health professional, so I spend a lot of time working with individuals who do have housing and don't have housing. I work with Polk County. I do crisis services through them, as well as private practice mental health. And I have young kiddos, so this is a community that I really want to see thrive. I want to be able to see my kids and their peers thrive in the community. So yeah, I'm just excited to help contribute and yeah. Thanks.
My name is Takasia Wydro, and I'm representing Sheridan Revitalization. We have been a community group since 2016, 17. So I'm the president. For the most part, I think I'll be here. I'll be the main person representing Sheridan Revitalization. On a personal note, I was also born in Willamina, and I spent most of my life in the Yamhill County area, so I love this area. I'm very passionate about being a part of this community and hopefully helping with this.
My name's Margaret Buckman. I've lived in the community for about 30 years and concerned about what's going on in the area and want to be a part of what's going on.
I'm Bobby Davis, Roberta, I don't use that. I'm the service officer for the American Legion, which means we usually focus on veterans, families, and so forth. But what's happened with us is we have a lunch program, 2 days a week, and we send extras and cover over on the weekends. We also provide winter warm items, as well as anything else that comes in. Homeless come in and they need shoes. Can't keep shoes, so I usually send them to the assignment store with Dorothy Tuck. She's really great with it. We have a program worked out, whereas if I have somebody who needs something I don't have, and I send it over there, I just put myself in and you pick it, we put it on the list of, on my account, and it's taken care of. Right now, we're serving approximately, actually at least 70 meals, lunches a day out a week. We start with the warm hot lunches next week. And these are not including all the extra stuff that we've been sending. We send extra sandwiches, they get peanut butter and jelly from food bank, but they don't have any bread, so we send loaves of bread and rolls. And I mean, it's just, if you come in here and you're homeless, you're gonna leave with food and blankets and warm on. Everything else is not gonna leave because they're freezing up there. And that's kind of what I do.
Thank you.
I'm Julie Schuman. I'm the current president of Churches United for West Valley. Our main project is that we provide backpacks and school supplies to the West Valley children. That's Grand Mountain, Willamina, Sheridan, and we've even helped some people in McMinnville, Amity, etc.
You have us with hygiene bags.
Yes, we have hygiene bags too, and we've just begun a new project where we're doing what we call the Thursday food bags that go home with right now about 10 families through school, since we don't have school lunches on Fridays.
45 students.
Yeah, 45 people in the families, and that we'll be sending out our second week. And we're doing that in conjunction with funds from Red Carolina and a lot of really wonderful volunteers. The Nazarene Church has given us a place to store the food and put it together. Couldn't do it without that. We do other things as well, but it mostly involves children. Not always, but mostly.
Yeah, I'm Nick Gentino, also a co-member on the board here with Julie for the West Valley Church. So you already heard the routine and doing the support.
Recording in progress.
So that's what we do.
And then I think we have, is Carrie on the Zoom?
We do, give us just 1 second, there was a little issue with somebody's audio, and I wanted to make sure that they could hear us. So, I think we'll make it better figured out for us, so it looks very good now. Okay.
So yes, I'm here.
Yes, Carrie is your other task force member that is online, so Carrie, go ahead.
So I'm Carrie Martin. I'm the executive director for Encompass Yamhill Valley, which is a houseless service provider in all of Yamhill County. We do lots of partnerships with many of you around the table. And we provide emergency, transitional, and permanent services for people experiencing houselessness. And I'm a longtime resident of McMinnville.
Thank you, Carrie, and glad you're able to attend there, so. Well,
One late arrival, just
Oh,
right on
okay.
time, here's Amanda.
okay, we're just doing Amanda introductions here, introduction, who you're with, and a little bit, if you're from the area, or where do you live and stuff like that.
Absolutely, yeah, so I'm Amanda Weidmark, I'm the executive director for West Valley Community Campus, which is the community center based out of the old Willamina High School. I have been here for about 1.5 years now. I just moved to the area from Arizona, so I'm a new Oregon resident. And I really wanted to be a part of the task force because of my firsthand issues with mental health. I'm really open about my own mental health. I've been going through struggles with depression and anxiety for the past couple months. I've been in inpatient treatment twice in the past couple months. And during my time there, 90% of the people in the hospital with me were people who were in there because of mental health issues or because of addiction issues and had no place to go once they left the hospital. So when I saw this opportunity came up, it really touched me. And then I also have history with people, especially teenagers who had to couch surf, had nowhere to go, had to live on the streets, and yeah, I think that's it.
I'm glad you're here.
Thank you.
Yeah, thank you. Well, thank you again, I appreciate all of you for, spending your time here this afternoon with us, you volunteered. It's really helpful, right, and I am impressed, we work with different cities, and Sheridan's doing a really good job, and the mayor and the council here for really giving a strong cast of, representation from your community. And that's really important to have this healthy conversation that we're having here at the table as we go through and look at the, the homeless situation in Sheridan to have you participating in that. That kind of takes us to the second item on our agenda here, and that's just kind of discussion of meeting rules and procedures here. And, we all want to be respectful here at the table here, so we can follow Robert's Rules of Order, which is a normal procedure that kind of happens in the council, but I kind of want everyone to have good, collaboration frequently. So when you want to speak here, I just ask that you turn your card up like this when you want to speak, and then be respectful of the person's time there, and then, put your card down when you're done there. So as we go forward in future meetings, that's just the way that we can handle that as far as talking and being communicating to each other here too. So again, this is just a task force member here, so people from the public can absolutely listen in, but if they do want to speak, there's a time for that. It's at the city council meetings, they can sign up for that. So this is, subject to zero heart to everyone within the community, but just so everyone knows that that's the represented time here. You're the task force that's going to be talking, and we're going to be shaping. And we'll be reporting out to the mayor and the councilors, and they're more than welcome to listen here, come in here to, as we go through this process there, so. Any questions on the rules and procedures from that standpoint? So we kind of have a pretty general free flowing here. I don't see this for getting out of hand or anything from that standpoint, right? So, but we just need, from that standpoint, right? So, you're a pretty rowdy group already, I can see, right? All right. So the third thing is, background on the House bill. I'm gonna ask the city manager to talk about House Bill 3115. This is, I think, helpful for you all to understand how the city has funding from that aspect there. So with that, Carrie, Carrie, you're more, Carrie, if you don't mind speaking about that.
Or even Amber at the end would have a lot more.
Carrie or someone else, Carrie's more knowledgeable about this one than I am.
Carrie, would you mind, we'll put you on the spot.
Carrie, do you feel like, I feel like you are a very good, or have a lot of background on House Bill. I mean, I'm happy to talk about what it means from the city perspective, but do you, I know you are very gifted at explaining things to people.
Well, that sets the bar high, and I'm sorry, because it cut out a little bit, are you talking about the measure 110?
No, actually, House Bill 3115, do you wanna talk about that? Or do you want me to? Sorry.
Why don't you tackle that, and then I'll add anything that you need, that
Okay.
I can think of.
Okay, essentially, there was a ruling, a court ruling that came out of Idaho, and it was handed down to the cities. I'm making this very brief. It was handed down to the cities to essentially make some decisions about what they want to do regarding houseless populations. So people are, because they're humans, are should have the right to a dry, it's dry, I'm getting nervous now. And, Daisha, let's see that word, dry and warm, is it warm? Amber,
Yes,
help me. Dry and warm, place to rest, to sleep. Because sleep is a basic human need, is what the basis is of that. So with that, what comes is what people see as houseless, and that is people sleeping on streets sometimes, and those are owned by city, right, the right of ways of cities or in the parks, and those are public property. So what that means is if a city or county, a jurisdiction, does not have a place for people to have their basic right of sleeping in a warm and dry place, then the people can sleep in a public area.
So I think that sounds great, and the only thing I would add to that is that, this topic comes up a lot when cities and other local governments look at creating ordinances, as a response to public complaint. And really, it is, from a legal standpoint, you must have a reasonable alternative. So you can't ask people not to sleep on public property or public right of ways if you do not have a reasonable accommodation. And that is, there you get stuck with the reasonable word, but it has to be something that they can reasonably be expected to access or get to. And so that is, it prevents an ordinance from taking effect if you do not have an alternative.
And when she says access, that's access for all, so that is a low barrier option as well.
Excuse me? Does that have to do with the populace of how many people are in the community or how many homeless people are in the community? Or is that something that doesn't have to do with the populace? That it's mandatory for all cities to conform to this?
So it is a state ruling, and so you don't have to conform necessarily, it is what it is. Some cities have taken the stance of doing nothing, and then they assume that people could sleep outside, and they may be okay with that. And the reasons why they may be okay with that, I don't know what that is. It could be anywhere from that's what, they don't have any other alternatives, it's a financial thing. They could be okay with it because maybe they don't have a lot of houseless population, or they don't think that it's a good place for them to make a decision, right? So there's all different reasons why, and then you go to the full other gamut where there's other cities. I think Amber could probably talk much more about what they're doing especially in McMinnville, but Mac has, new public shelters that have opened up for people in the hotel.
Yes, we have it's called a non-congregate motel program, which just means, well, it's an old hotel, so it's unlike a traditional shelter, if you will, where people are maybe sleeping in cots 6 feet apart. You have your own separate room, and it prioritizes, that program, Project Turnkey, prioritizes medically vulnerable and other certain populations, like those with children, those who might rely on electricity electricity to survive, for example, so that's how it originated. It's kind of evolved over time a little bit, but there's currently, I think, 30 rooms there and roughly 2 beds per room, so depending on the size of the household and the makeup, we're trying to expand that so that we can do some construction, open up all 70 rooms in the facility, but that's a work in progress.
How many people are in your community and how many homeless spaces do you have?
So that one currently has 30 rooms, and I wanna say they average 2 people per room.
But what's the populace of McMinnville to how many shelter beds you have?
That is what I know. I do know we're also opening up another homeless shelter / navigation center called NE Workplace. So there's 2 existing buildings that were like family shelters that have run for years that YCAP has owned. This even predates me. And they're in the process of renovating those so that they're right next to each other, like right next door. So they're renovating them so that they are connected and can be 30-bed shelter by night. If I recall correctly, it'll be 30 beds at night. And then during the day, what we call a navigation center. So it'll be where we can invite community partners like Provoking Hope or others to come during the day, and people experiencing homelessness can just get a hot cup of coffee. It is low barrier. It's intended to be sort of meet you where you are with the goal of slowly building trust, rapport, and being there consistently. So when that individual is ready to access services, they have a routine place they can go that is safe for them to access those. That's construction right now, so we're hoping this summer it will be open. It's a very long process, and that's been in partnership with the city of McMinnville and state funding. It's been a very big multi-year project. And we're doing a similar thing in Newburgh, but on a smaller scale.
Thank you.
Great. Yeah, thank you for that. Karen, you have your hand up too?
Yeah, so I can't see your name tags, and I tried to write lists, and now I don't know who any of those correspond to. Yes, so Amy,
Yes.
striped shirt, I'm glad I didn't have to play striped shirt. So you brought up 2 really good things, and I don't know if you got a firm answer on that. The first question you asked was about the population with respect to the ordinance, and the answer to that is both yes and no. If you have any ordinances that curb any kinds of activities for your houseless population, regardless of the size of your houseless population or the size of your other population, you have to have adequate facilities to meet whatever that need is. So it could be 5 people, it could be 50 people. So you have to have adequate facilities, reasonable facilities for those people if you're going to make an ordinance. And so you have to meet that need, whatever that need might be.
Okay,
I
so
think that's what,
pardon me. So what you're saying is for us to say that the homeless can no longer be homeless on our streets and need to be sheltered, we have to offer them a shelter to go to. Is that correct?
right, essentially, yes. So you have to have a reasonable alternative, which brings you to the second question you raised, which was about, I think, what is the need? And so that's the key question. That's what the point in time count does, which has been a wonderful resource that everyone uses, but has been really tough since pandemic. And we have a lot of high hopes pinned on the one in January, but that's what we need to find out. What exactly is the need so that we can see, do we have adequate facilities to meet that need? And right now in the West Valley, that is largely unknown because you have the visible and the invisible houseless populations. But it's the same in the other communities. We are relying on this data to tell us, all right, we've got 35 beds at Project Turnkey, or we've got another project that has, 30 low barrier beds. How close are we to meeting the need, and what do we need to do next?
If our community is unable to support the people in need, would it be an option to send them to another facility, or is this something we need to do completely in-house?
That's a great question, and probably Heidi wants to weigh in too, but for Encompass, we went to both the city of Sheridan and we spoke with the city of Willamina, and it just so happened that the day we spoke with Willamina, they had an attorney who was giving them guidance on creating their own ordinance. And so it comes back to that word of reasonable, and a reasonable accommodation. So is it reasonable if somebody has to travel 5 miles? Is it reasonable if they have to do it by foot, or if you have to provide a bus pass? Those are things that will largely be decided in courts once somebody challenges them. So, you know, it's the threshold of what is reasonable that we really need to try to determine a standard for.
Thank you.
Yeah, thank you, Karen, thank you, because I think, I wanna go back to the beginning of the meeting, like, you know, the first thing we gotta do is get the data, right? So, I don't want anyone jumping to, you know, conclusions of where we're gonna be, but I think to Carrie's point, and I'll just jump to our next item down, we'll skip, 4 and council's jump to 5. And that is gathering data. I mean, so many decisions, we need the data first, right? So you have here a handout, when they're gonna be doing the point in time count, that's January 24th there. And if there's anyone, you know, if there's people within your organization or people within the business community or anyone that can help to really gather this data, because the data is important for us to have and understand, you know, what is that number and what is the situations of the, you know, individuals that are in need of assistance, right? So once we have that data, right, that starts to really help shape the conversation of understanding the resources that we have within the community or with partners, right? With other agencies or other entities, whether it be county or cities or other nonprofits, and what's that look like from there, right? So, and how, you know, maybe it's an IGA with another city, maybe it's with the county, so, you know, as you look at different facilities or how maybe the resources that you have can be shaped into a resource center to help within the community there. So, I think if you can look at this, if you can help, reach out to Amber. Again, if you have any additional information, I know some folks might wanna do some work, you know, polling or researching, gathering, please do, and let's get this all gathered up and move forward to gather that information after discussion. Yes?
Speaking of data, knowing that, right, we're talking about kind of visible in terms of individuals that we see sitting out in the streets. Will we have access to data around maybe families in our school districts? Obviously, those are typically more invisible families, right? They're usually couch surfing, we have teens who are couch surfing, but very much still counted as part of the houseless community. Will it be will it be an option to be able to have access to some of that data? So as we shape our resources, we're able to have a fuller picture of who needs resources, what that support looks like for families versus just individuals. You know, differences between male and female resources. I know working in emergency services, there's a significant difference in needs sometimes, and domestic violence. There's just a lot of factors that go into that, especially when you have families and kids involved.
To answer your question, I think the more data we can add, the better to that situation. To your point, right, like, we know there's families that are in the school district that are just above houseless, and what are their needs? You know, we hear about the backpack lunches, the backpack programs, right? So, we hear there's women and men that are in different situations as far as that, right? So just, I think for this group, for us, the more information that we can gather, and then we report out to the council, right? Like, okay, here's what we found, you know, there's these types of situations within our community, right? And that really helps to shape, like, what are you gonna have in your community? Each community can be different, right? You can have different types of situations where maybe the school district has more homeless people than another community, right? Or maybe there's more women that are homeless that need a different type of, you know, program or shelter. Or maybe we need workforce training, right? Because, you know, people just, you know, so really, I just look at for us as the group, right? Today's introduction, understanding what we're here to do, and over the next 2 months, gather the data, and then we'll have some healthy discussions around that, right? And really understand where we can, you know, we can report out to the council and keep the council appraised of, here's the data, what we found, here's the different layers, and here's what we're gonna be doing next from that standpoint. But that's great.
And you've got Amber too that wants to talk, and then Carrie.
Okay, so,
There's, I think,
okay, all right, okay, and I know we can keep this in the,
I think a couple of understanding about the point in time count that is helpful is, yes, we do engage the schools, we contact homeless liaisons. In smaller communities, the homeless liaisons tend to be anybody who is thrown that title, which can be very challenging because they don't usually have the capacity to do something that like McMinnville or Newburgh with dedicated at the core, point in time is a survey that we administer with individuals. And that survey will tell us whether they're homeless, unsheltered, sheltered, vicariously housed. It's a relatively short survey that's intentional because we want to incentivize people to take it, not traumatize them, not ask so much personal information that we don't need. I think the other important factor to understand about it is it's driven by HUD. So the federal government through that HUD gives grants to these regional continuum of cares. The one that we're in is called the ROC, the Rural Oregon Continuum of Care, who then grants to organizations like YCAP, who gives us the directive that we have to facilitate a point in time. But a point in time is not a YCAP project, it is a community event, and the more successful it will be is the more people are involved. So the more organizations who are out there, the more people who are out there administering that survey, the more likely we are to capture everybody. And I'm really happy, Carrie and Encompass has offered to help lead a lot of that effort in the West Valley, which will help make sure we have a really dedicated effort out here, whereas perhaps in the past, not the one.
I've heard low barrier mentioned a couple of times. I was involved in the cooling center talks. So I understand low barrier, high barrier, but I'm not sure everybody here does. Would you want to explain the differences?
I think you're probably better explaining this, so go ahead.
Okay, great, we've got Amber.
For Amber,
It means you can't put preconditions other than just general behavioral expectations on receiving that service. So if I'm a low barrier shelter, it means I can't require that you are sober to enter. But I can require that you are not rowdy and disturbing the health and safety of either yourself or other residents. So basic behavioral compacts or understandings are and can be part of a low barrier shelter. But you can't otherwise have preconditions like sobriety, like requiring someone to get treatment, like mandating that they do case management even if you think they really need it, or go to substance abuse counseling. You can't put those requirements on it. You even have to allow pets, again, as long as pets are well behaved, maybe kenneled and on a leash.
At low barrier.
Correct.
okay, thank you for that.
No, I'm good.
Along with that, you can't require medication for anyone who has a diagnosed mental health disorder, so that also falls under that category too.
So I just wanted to ask, how many would be the ideal number of volunteers? Is there any age limit, physical capability that I should know?
So we tend to do it in a couple of different ways. We have street teams, so those are the ones who will canvass the streets and try to find those who are unsheltered, maybe aren't accessing services at the Legion, or who aren't going to a homeless shelter and staying. So like pantry partners can be really integral in that. The schools can be helpful because they're gonna catch a lot of those families that maybe aren't as visible. So we have the street teams that go out and get the, unsheltered count typically. We do those in teams of no less than 3 for safety. You have, and Carrie can probably speak to that because I know her organization has done a lot with street outreach and work about population. But no less than 3 is ideal so that you can have a solid, safe team, someone to interact, someone to kind of keep watch, someone to take notes. And then you have drop sites. That's places that people experiencing homelessness frequent. And those are places that you can do it at, like the Legion. I keep pointing to you, Bobby, because I know you see a lot of people experiencing homelessness there. You could have that as a drop site and advertise it so that people experiencing homelessness know that they can go there and take the survey and in exchange get socks or a hot meal. So we do try to give something in exchange, usually basic needs and supplies. So it kind of depends on the size of your community and where people are congregating.
I think if we could know, like ideally it would be if we could have 30 volunteers and just so I can do my own outreach to using up my various connections on so that I can figure out, okay, like what's the time period that they need to be asked, how do they reach out, like do they just email you? It is much information that you can give me that I can try to.
If you leave me with your email, there is an email that I sent that corresponds to this flyer that has some of those details.
Okay.
We do require a training, and that's again to help understand how to administer the survey properly, And also safety factors, so if you are on a street team versus maybe in a homeless shelter, there's different levels of inherent risk, if you will, so we try to help understand those things. So it's a 1 hour mandatory training for anyone who's volunteering on the day of the event, and it's kind of an all-day thing, depending on, again, you wanna kind of customize it to your community to some degree, you don't need to have 50 volunteers if you don't have that many people, but you at least wanna have one solid team that can canvas the entire community, and I would suggest no less than 1 drop site, maybe 2 if you really want to feel ambitious, so that people, maybe they don't wanna go to the food pantry, they can go to the library, or they can go to the Legion. And at each drop site, depending on the volume of people who are coming, again, probably 2 or 3, I would never recommend, just 1, again, just for safety factors in general, but 2 to 3. Okay.
Those are great questions. Amber, when would the training take place too?
We need to work with Carrie to
Okay.
settle those dates.
It seems like it's coming up pretty.
Yes,
Yeah,
it'll
we
be
have Christmas
early.
holidays coming,
We're looking at
right?
early January, and Encompass is going to help with that at training. So that's part of the reason I'm deferring to her a little bit, and she and I are gonna touch base in the very near future to have some of those details.
Yeah. So we're gonna be coordinating the West Valley pit count and some of the training we're gonna assist with. And really the West Valley has been underserved in the county in the past, and part of what Amber mentioned a bit ago is that, you know, while it's a mandate for YCAP to facilitate this, there is no money to assist with it. And so, you know, it makes it really challenging to do this heavy lift when there's no financial assistance. So we are already working to have a game plan. And that is going to be first looking at what are all the existing resources that we can connect with, whether those are service providers or shelters or churches or school districts or law enforcement, you know, making sure that we collect the data that is already existing in some format, and then create our outreach teams and get the volunteers recruited and trained. I know there was hope to do some initial training in December, but it gets really challenging to squeeze that in. So maybe there'll be some in December, and then we'll hit that in January. But we're already looking to sign up people and to get people ready for what that will encounter, or what they will encounter. I'm hoping that that's something we can talk about but I'm not sure what the frequency of this is gonna be, but absolutely would love to be able to share that plan and to get people signed up for that when we're ready.
Thank you, Mary, that's great, and that kind of, sorry.
I just have a question as we're talking, right, as someone who's newer to the community, I know that we talk about West Valley a lot, right? So we have Grand Ron, we have Sheridan, we have Willamina, but I also realize as I've lived in the community that there are a lot of things that are separate, right? So we have separate school districts, we have different things. So in terms of our job that we're trying to do here and what we're trying to come up with, are we focusing solely on Sheridan, or are we focusing on the larger community abroad, right? Because we have someone here from West Valley, that community center is in Willamina. When we're talking about the point in time, we're talking about individuals in the West Valley. So are we broadening? It sounds like Willamina is talking about their own city ordinance. Where are we focusing, right? Knowing that we have some people who go back and forth, we have some people who are only here. What is kind of the boundary there in terms of support and resources?
Thank you for that. So this task force is working for the city.
Okay.
And a lot of times to have, you know, when I commend the city and the city council for looking at this, having good representation, because you need other partners when you're participating and looking at that, you know, for example, we have, you know, people here from McMinnville outside, right? Because as you start to craft and find your solutions, as we understand the data, right? Those players could become partners in solving your solutions, right? So, but the task force here is gonna be reporting to the council, and we're looking at it for the city sheriff.
So I guess my question a little bit more sorry to find is, so point in time is gonna take into account individuals who are across multiple communities. But our job is, we are designated as the city of Sheridan, right? So when we talk about reasonable alternative resources, how do we split that number up? Or do we just say, you know what, why don't we cover all of the individuals in this point in time count for the sake of being reasonable, or are we having to filter that down farther, because we are only focused on the city of Sheridan?
Yeah, I think the first thing, let's get the data, right? It's a, you know, that's 2 meetings out, right? So like, you know, I think the main thing we can do is get a press release out that you need help for finding the point in time data, right? So the more we can help get the, you know, Carrie and Amber, you know, getting the data, and then when the data comes back, it's a healthy conversation we can have there, right? And then when we look at the data, we can update the mayor and the council. Here's what we see in the data, right? And that just helps as we look for solutions, understanding. Right now, we don't know what the true number is. Anyone can spitball 15 different numbers out here, and until we have that and logically understand that and what resources that we have in the valley, then we can start to blend those together and shape the program, right? So, you know, I commend you know, the council for having a wide representation, because it takes a village to kind of understand this, and you're having healthy conversation at the table. So.
I do think it's really important to understand though that the point in time that we are required to facilitate tracks countywide data, it is not community specific. So as
So that's
you're
good
going
for
through,
us to know.
correct,
Okay.
so if you want to, and that's maybe something when I'm planning with Carrie, we can think through what is the best way to capture that for you, because we don't have the capacity to break it down community by community. But if you are the ones collecting the surveys, you can safely say that you collected 50 surveys in the community of Sheridan during the point in time count. And that would be, you know, separate from our countywide analysis, but it would still be an accurate representation of what you did and allow you to get the more localized data that I think you're seeking, that the point in time does not otherwise have. The other thing I wanna note, we don't dictate the questions on the point in time survey, that's also dictated by people above us. It's standard demographic questions, so you will get some of the things that I think you mentioned, but if there are other things, we have to look and compare that to the survey as it stands to make sure it's in there and work around that.
And if I can add to what Amber said, you know, there are strategies for organizing these efforts in such a way that you get qualitative and quantitative data that will allow us, even though it's a regional approach and we're doing a regional survey, we want to be able to pinpoint the specifics. And sometimes the houselessness is not, doesn't observe the same boundaries, but we'll be able to find out from, you know, the pantries and the churches and what are they seeing, and be able to isolate some of that data so that when we come back, we can say, we have a reasonable expectation, or we have reasonable data to suggest that this is the number of houseless people and people experiencing other housing instability within the boundaries of Sheridan.
Sorry, I don't wanna, I'm working on a community needs assessment also for YCAP that looks at the entire county, and we are trying to find community specific data. So there is some based on like zip code data that does show like rent burden percentage of households in this area or this zip code that is severely rent burdened, meaning 50% of their income or more goes toward housing versus 30%, which is considered rent burdened but not severely rent burdened. The recommendation that they say is it should be 30% or less of your income, so anything above that is considered at risk of precariously housed at the very least. So I think you can combine those data sets, and I've already done some of that research for this other project that I can bring to the table at that time to get a more comprehensive picture, because when you look at HUD definitions of homelessness, it can be very limiting, and that's why you can use that kind of auxiliary data to get a more complete picture of the situation.
Okay, just being mindful to our time here.
We, the 24th of January is this survey.
Yes.
On the 23rd of January, the Methodist Church will be handing out sack lunches to all the people in line with that food bank and others in town. So that would be a great time to advertise this. If we have to change the date, it would be a great time to
Can I
collect information.
address, so it gets confusing, but technically HUD lets you do 10 days around, it always wants to be.
Okay.
So we can administer that survey on the 23rd at that location and still do the big street push and everything else and have those drop-in sites on the 24th. There's an attempt to unduplicate the data based on surveys that are like identical. It's not a precise science though. That's one of the risks you take in doing that. But it is possible and feasible to do that if that is a more adequate way of pulling it off.
I just think we could reach a lot of people
Yeah.
at that time.
And they're already there.
Cavalry Church on that Thursday, we got a line full of homeless people, you know, like talked it all the time. But we could do it that
Well,
way.
let you, coordinate with Amber on that and,
Yeah.
do the plan next time there. So, again, I think if we can put it on, Heidi and Mayor and the press release for this city to help get some volunteers out ahead of time, that will be helpful to go and happy to help you out there too. So jumping to the last two items here, kind of an assignment that I have for the group, and again, we're gonna be looking at the data the next couple months here. But what I'd like you each to do from your organization is just, email Heidi, and then I'll get it from her, the staff here. What resources you have, available from your organization, right? If you can put that and then we'll compile that, because that's gonna become helpful, as we go through and understand the data. But I'd like to start with everyone just putting together with a 1 or 2 page, information, whether you provide backpack lunches, or you provide a hot kitchen, or you have rooms, or your mental health, or you provide workforce training, or all those, if you can just email that, because that all is gonna come into looking at kind of the future, how those resources become available. So that's kind of your assignment for next time. If you can get that done in the next, week or so, that would be very helpful from that standpoint. Any questions on that? Yes.
I kind of want to know the definition, we kind of skipped over it, of homelessness, of the homeless.
Houseless, homeless there?
Yes, I would like to know the definition, because we have a lot of people in our community that are sheltered in back rooms, garages, RVs.
Backyards.
Yeah, and trucks on the street, and I wanna know, do we consider all of these people homeless? Or underhoused?
They would be under the umbrella of the unhoused, yeah, so like that was the term precariously housed, so, yeah, right, so it's that stability of housing, and they would all be, if they cannot provide their own stable housing on a consistent basis,
And
then,
family has taken them
yeah,
in, or
then they
neighbor
would
has
be
let them
considered part of the umbrella of unhoused.
Alright,
Yeah.
And
And I
there's,
think from that, though, you have to, from that, again, when I say you probably would have these different layers of buckets,
Mhm.
right? Then what do those folks need? Do they need training or reprogramming, right? So then
Jobs,
jobs,
yeah.
right? So you start to understand that, right?
Yes.
So like, someone that might be, couch surfing but just needs job training to get back in the workforce, right? So then, as you think about that, and then it's like, in our resource center, do we got, someone that's helping with workforce training and engaging them back into workforce, right? So there's those different layers, and I think because, housing prices have gone up so much in Oregon, right? It's naturally because when you start looking at those different medians, right, and the income jobs, those are things that we're probably gonna see as it comes out this, we're gonna find folks that are houseless, maybe living in an RV, home, living couch surfing, or in the school districts, barely getting by, right?
Mhm.
So it's all those things, understanding that, I think, and that's why it's helpful if you all can just kind of send in what are kind of the resources, and we'll share that. And we may say, like, we're missing some of these other resources, right? And who should we have at the conversation at the table to be helping with those different layers and that, so.
Thank you.
Okay, last, is just, again, the meetings will be monthly. The second Wednesday of the month at 4 p.m. here. We may in the future do some traveling, looking at some different spots and locations, so, but the next meeting will be here, that would be January. Yes, it's gonna be January 10th at 4 p.m. And again, I just want to thank everyone here for your time, greatly appreciate Sheridan, what a fantastic group to see out here and just, talking and having this conversation, so, appreciate all your time and thank you.
Were we gonna discuss having a town hall meeting for Sheridan?
I think let's get the data first, let's get some data and let's have some conversations here. I think we're too early to be, even engaging in having a town hall. Let's get the data, let's understand the demographics of what we have in our community. And then from there, we can talk about the town hall, from there. And have some conversations with the mayor and council first. We really need to understand the situation. As a thought. So thank you so much for your time today, and we'll see everyone next year. In the meantime, remember, resources.
Thanks a lot for coming.